Let's look at overcoming hesitancy to provide a weight control service in the dental professional's office or clinic. Whether it's concern over safety and effectiveness, unwillingness to break norms, or fear of taking on a process that may be beyond them, dental professionals are hesitant when it comes to providing a weight control service in their practice. Why? Are there reasons based in reality? The time has come for them to begin embracing the newest specialty that dentistry offers today: weight control, as I have defined it. From my perspective, as the inventor, developer, and leading provider of one such service, OJW weight control, it is clear that their hesitancy is built around a number of myths and constraints that have permeated our dental profession. Let's have a look at some of those and demythify them. We'll show how specious each one is, and that nothing is truly preventing us from providing this worthy service to those who would welcome us and benefit from our efforts on their behalf. This is OJW weight control. It's a dental appliance and protocol I invented and developed that is the mainstay of a weight control dental service. It permits a patient's jaw to be wired into its normal resting position, and in cooperation with a healthcare team, I have helped more than 350 patients to curb unhealthy eating habits over the past 25 years. The protocol for wiring 55LC-LD is 5 weeks wired and 5 days unwired on a low-calorie liquid diet. Now that you've had a look at it, we're ready to examine the myths and constraints that render dentists hesitant to incorporate this service into their dental practices. Myth and constraint number one, that is tradition. How is it that cleanings, fillings, crowns, dentures, root canals, and removing teeth have become pillars standing in the way of progress? It's not the services themselves that are at fault. It is the narrow view of dentists who believe there is a limit to the services they ought to provide beyond those traditional ones. Doubtless, we all find our comfort zone when standing on familiar ground, but once we see that the new ground is a smooth road that has been bridged, we can reap its rewards. In fact, I look at my work as a superhighway, one that I have created to make the trip both safe and inviting for others to travel on. It is understandable why dentists would perceive weight control as a service far beyond the scope of the ones they should provide or feel comfortable providing. Admittedly, any such service would fall outside of a dentist's comfort zone, especially because it's not taught in dental school. So where do they begin their education? At Weight Control 101. And here I am referring to the ebook I wrote entitled The Dental Professional's Guide to Providing OJW Weight Control, and the video I produced entitled The OJW Fitting Appointment. If you see yourself in the above description, my words will help quell your apprehensions and show the way to introducing a weight control service in your office or clinic. To escape the shackles of tradition, you must be prepared to rebut the raft of criticisms you are likely to encounter, including derision, even from your colleagues. I will remind you that the inception of orthodontics was greeted with roars of opprobrium. I wasn't cast in the traditional mold, and my example should help you break yours. I was a bit of a renegade from the start and unafraid to stretch the rules without fear of retribution from the District Dental Society or my colleagues. Moreover, my practice was in downtown Brooklyn, New York, where it was possible to express a measure of nonconformity. It was only by chance that I was introduced to the concept of providing weight control. However, even then, a voice in me persisted in repeating, "This is something that is really worth developing. It will benefit me, enrich my life as a dental professional and the demographic I serve." I was never deterred by criticism. I even encouraged others to voice theirs. Indeed, I fielded each critique, examined it, weighed its reasonableness and rationality or lack of import, and moved on, satisfied it was not an impassable obstacle. Finally, there were none left. I'm now reaping the fruits of my labor and determination sowed over the last 25 years. That brings us to myth and constraint number 2, the scope of dentistry. Dentists erroneously believe that weight control is not a service included in the scope of dentistry. That's exactly what I thought. Consequently, I contacted Dr. Milton Lawney, who wrote to me saying, regarding the Code of Dentistry, referring to New York Article 133, paragraph 6601, Dr. Milton Lawney, the Executive Secretary of the State Board of Dentistry, New York, in 2004, said it's not within the scope of dentistry to diagnose and treat independently the condition of obesity. Dental appliances aimed at weight loss may be prescribed if the condition is diagnosed by the proper authority. When I moved to Portland, Oregon, I petitioned the Oregon Board of Dentistry and they wholeheartedly agreed. Those who already treat the symptoms of sleep apnea will recognize this pathway, and those who are looking to travel in this direction should know that it is legal to provide this new service in every state of the Union, bar none, just like treating sleep apnea. Once the physician makes the diagnosis, that is your imprimatur to make an appliance that can aid in the treatment of the condition. Number 3, acceptance as a weight control provider. We've knocked down 2 myths and constraints already. However, I can hear you saying to yourself, but the general public will not accept me as a credible weight control provider. Again, that's exactly what I thought, until I conducted a study with a sample of 100 and found just the opposite. Witnessed my own experience with 350 patients from everywhere in the United States. We must first believe in ourselves, believe we have the knowledge and skills with oral appliances that can make a difference for our patients with weight control issues, just like we did with TMJ and sleep apnea. Fear itself is the major obstacle. Myth and constraint number 4, jeopardizing your dental license. There is a belief among dentists that weight control is a medical, not a dental service, and consequently a threat to their dental license. Nonsense. That's totally incorrect. Weight control is a dental procedure, first, last, and always. In fact, it closely parallels providing treatment for sleep apnea. The physician diagnoses the condition, permitting the dentist to place an appliance to relieve the symptoms of it. Indeed, weight control is often the treatment for the etiology of sleep apnea and type 2 diabetes, and that is obesity. Number 5, peer perception and reception. It is legitimate for dentists to fear they will be castigated, rebuked, or even ostracized by their colleagues or other people they may well respect. This is true in small town practices, less so in urban centers and multi-specialty clinics. This world is replete with people who will naysay whatever you do. Nevertheless, you have to believe in what your dreams tells you feels right for you and your practice. You have to believe in yourself and feel confident that you can fend off the criticisms you might have to endure at the start. Once you begin to realize the good you are doing and the positive effects of being a provider of weight control, ignoring the naysayers becomes a piece of cake. Indeed, you will teach them. Myth and constraint number 6. Obesity has a multifactorial etiology. Is the etiology of obesity so multifactorial that any efforts to treat it may be misguided or misdirected and cause harm? No, is my answer. But a good many dentists are frightened of that anyway, and that's fair enough. However, upon examination of the 5-part application form, including informed consent, medical dental history, poor candidates, and other that I devised for my prospective patients with weight control issues, you will rest assured that the patients you carefully choose to treat will be the ones you feel confident in having in your practice. In essence, I have opened up yet another lane along our superhighway for you to follow confidently by my side as we continue to our destination. Isn't that exactly what you would do with all the dental patients you treat? You screen them, obtain their informed consent, and decide which ones you feel you can treat and meet their expectations without causing them harm. Constraint number 7, device safety and effectiveness. A prime concern going through your mind right now. Any devices I use must be safe and effective. Of course, first do no harm is the ultimate dictate of medicine and dentistry. I invented OJW weight control and appliance and protocol and refined it over the course of 25 years. Try to find a bad review. There are none. The worst that has been said is that when the appliance is removed, the patients regain weight. However, isn't that axiomatic with all weight control methods, bar none? So here we are, myth number 8, TMJ ramifications. Dentists have apprehensions that an intraoral device for weight control may initiate or exacerbate TMJ problems, ditto sleep apnea appliances. Nothing could be further from the truth. I refer you to my 2009 research paper I mentioned earlier. Not one respondent in my study reported a TMJ problem. Indeed, I have treated more than 350 patients without a single report of a TMJ concern. Moreover, the position of the mandible in OJW is physiologic, as it approximates the rest position. Rothstein's OJW position of mandibular weightlessness, ROPMW. The wiring does not suspend the jaw, it simply limits how far the patient can open their jaw beyond the rest position. Finally, the protocol for my method, 5-5 LCLD, 5 weeks wired, 5 days unwired on a low-calorie liquid diet, further ensures there will be no problem. Nevertheless, I always take a pan x-ray showing the condyles, get a medical history, and do an oral and TMJ exam at the start. Myth number 9, there's nothing to gain. The same way that you make investments in other areas of your practice and enjoy the resulting profits, providing weight control can also have an appreciable ROI, return on investment. Dentists must begin to envision weight control as a profit center for their office clinic. Do you remember that movie with Kevin Costner, The Field of Dreams? Build it and they will come. And nothing ventured, nothing gained. You will gain a potentially substantive revenue stream, the respect and recognition of your colleagues in dentistry and medicine, and finally, gratitude from the patients you help with their weight control issues. On to number 10, self-consciousness. Perhaps you perceive you have a weight control issue and prefer not to draw attention to it, or your staff as well. Any of these factors may make you think twice about providing a weight control service. On the other hand, you might use it as an opportunity to place it on yourself or your staff gratis. Imagine the wealth of publicity that could attract. Provide the service gratis to a staff member as a real-life example of how well the method works. This is one of the various tools I have recommended to doctors learning how to provide the service. Let's move to myth number 11. Weight control is not supported by educators and researchers. That was true in the past. However, at the 2019 International Meeting of the American Association of Orthodontists in Los Angeles, two preeminent leaders in the field of orthodontics and chiefs of leading orthodontic departments in the most outstanding dental schools in the country, Drs. Ralph Behrens and J. Martin Palomo, made it clear that obesity is the single most important contributing risk factor for sleep apnea. Dr. Palomo even cited my work on the OJW Appliance and Protocol as significantly advancing the treatment of obesity. So, myth and constraint number 12, the mystery of weight control appliances. Most dentists are at ground zero with any weight control appliance. OJW weight control, which I invented and have continued to develop, has been shown through my work to be safe and effective. It has been applied successfully over the course of 25 years to more than 350 patients. It consists of an appliance and protocol and simple, inexpensive instruments to fit the appliance on the teeth. OJW is provided by the dentist as part of a healthcare team where the physician supplies a release for the patient to begin a low-calorie liquid diet. The dentist fits the OJW on the patient's teeth, and the patient, by adherence to a low-calorie liquid diet, 5/5 LCLD, assumes responsibility for their weight loss. Not a single state prohibits it. It's not a medical procedure, as many dentists misconstrue it to be. Dentists can and should use it as an alternative option to treating sleep apnea. The patients are typically very grateful, and even if they regain the weight, they will applaud your efforts. Here we are at the last constraint, number 13, liability insurance coverage. Liability issues and the problem or cost of obtaining adequate insurance coverage are serious considerations. Providing a service like OJW weight control is an issue that demands thoughtful discussion with your liability insurance carrier. While I was practicing orthodontics in New York, the insurance company that covered me added my weight control service to their policy after I described my research and the method that I was using and convinced them it was safe and effective with no untoward events or claims. When I retired from practicing orthodontics, they covered me for the weight control service alone. Then, when I moved to Portland, Oregon, I located a company that agreed to cover me for the weight control service alone at a reasonable price. I paid for it with my fee from the first patient. In your insurance deliberations, you are welcome to reference my work, my research, website, and experience. As you can see, the path for you to provide a weight control service and to use my OJW weight control method to do it has been cleared of all obstructions over the last 25 years through the work I've done and the investments I've made. The myths and constraints are gone, and you are now liberated to make a similar investment and provide the newest service that dentistry offers, weight control, and reap the rewards that come from it. The superhighway I've created is yours to travel down. Are you ready to take the entrance ramp? Now here's my definition and scope of the 13th dental specialty, weight control. Weight control is that specialty or branch of dentistry that is concerned with and recognizes the right and responsibility of dentists to provide adjunctive services with intraoral appliances as part of a healthcare team to the obese or becoming obese patients to control excessive eating patterns that can exacerbate certain dental and medical problems such as decay, periodontal disease, sleep apnea, and type 2 diabetes, among others. Here are some maps to help you travel down that superhighway I mentioned. A free ebook entitled The Dental Professional's Guide to Providing OJW Weight Control. A video entitled The OJW Fitting Appointment. A video entitled Providing OJW Weight Control, How the Dental Professional, as part of a healthcare team, uses orthodontic jaw wiring, OJW weight control, for treatment of sleep apnea caused by obesity, prepared for presentation at the American Association of Orthodontics. So, thank you for listening to me. This is Ted Rothstein wishing you well and hoping you will travel the same superhighway that I have cleared for you.